fair culture is necessary for safety. A culture that seeks improvement rather than blame is a safe culture. We call that a just culture. In the simplest form, a just culture is one in which people believe they will receive fair treatment if they are involved in an adverse event or a close call. They trust that their leaders will treat each event as an opportunity to learn and improve safety rather than place blame. For a just culture to exist, we must differentiate between systemic errors, normal human mistakes, and blameworthy, risky acts by acknowledging that both systems and humans are imperfect, and their behaviors need careful evaluation with a goal toward decreasing the opportunity for patient harm. In healthcare, most cases of harm are caused by a systemic error. Something occurred within the process that did not adequately recognize the potential for harm. A just culture is not blame-free, but rather a culture in which accountability is balanced between error recognition, systems analysis, and behavioral choices made in the moment. It is defined by a value-supportive system of shared accountability. The organization is accountable for the systems it designs and for responding to the behaviors of its employees in a fair and just manner. Employees are responsible for the appropriateness of their behaviors and for reporting errors, close calls, and system vulnerabilities. By way of definition, accountability is taking ownership of our actions and inactions, looking out for coworkers, and holding oneself to organizational standards versus commonly held standards. It's about fixing the process, not necessarily the employee. In a just culture, accountability and justice are blame-free, and justice is an inclusive culture where people are treated fairly and equally. All points require trust and transparency to function appropriately. Patient harm and close calls frequently occur because of seemingly inconsequential lapses in systems of care. Inconsequential because a single lapse did not lead to harm. These lapses need to be reported to management to ensure that a series of inconsequential lapses do not build, resulting in a consequential error. When pursuing a just culture, algorithms can be used to resolve an event with a constructive solution rather than an impromptu reaction. It emphasizes the solution over the team member at fault. These algorithms plot the approach used to apply the necessary questions to give guidance to leaders on how to approach the problem. Just culture algorithms customarily contain 5 skills: expectations, system design, team members' choices, training, and accountability. 3 duties: produce the desired outcome, follow the procedural requirements, and avoid unnecessary risk or harm, and the 3 identified causes of error: human error and innocent slip-up, risky behavior, knowingly choosing to break from protocols because they believe their break will not cause harm, and reckless behavior, knowingly choosing to behave in a way known to cause errors and harm. The type of error and level of risk taken by the individual will inform the organizational response. High reliability organizations may consider using the just culture to improve safety, increase core activity control, and improve their levels of quality and primary processes. Many hospitals and health systems view a culture of high reliability as a priority. As the shift towards value-based care models takes root, systems that reward positive clinical outcomes with repeatable, standardized processes resulting in avoided errors and delivered safe, high-quality care will thrive in the new order. According to the CDC, nearly 1.7 million hospitalized patients acquire healthcare-associated infections, or HAIs, annually while being treated for other health issues, and 1 in 17 of these patients die due to these infections. Considering this information, becoming an HRO is an attractive endeavor, and any means to improve processes like the just culture pertinent for all levels of the executive band and board members. Some theorize that an organization's just culture provides a foundation on which to build a high reliability organization due to the trust environment it cultivates, transparent reporting it advocates, and the team approach to care it encourages. A culture of safety begins with values and beliefs that turn into acceptable behaviors that promote organizational safety. Over time, this change requires a comprehensive commitment leading to an HRO status. Blaming individuals without evaluating the error in the context of a system failure impedes the learning environment in healthcare organizations. A culture of blame does not encourage the delivery of coordinated, patient-centered care. Instead, a culture that incorporates an emphasis on systems-based care, transparency, teamwork, non-punitive analysis of errors, and best practices is encouraged to improve patient care and establish a safe environment for patients and employees. To effectively create a just culture, leaders must commit to leadership rounding, employees and physicians must be recognized for their transparency, principles of accountability and fairness must be adopted. An understanding of organizational strengths and weaknesses can assist leaders in creating a just approach to incident investigation. When behaviors and attitudes are aligned, the approach to performance improvement becomes the standard work for all staff. Executive teams must invest in and commit to developing quality systems to identify safety risks and systemic weaknesses. Leaders need to look beyond errors to the system in which employees work and the behavioral choices they make within the systems and develop a transparent, non-punitive approach to error reporting. In addition, senior leaders should develop personal relationships with members of the frontline service, showing interest in their input and concern for their personal lives. This creates visibility outside the office and engages the employees. In doing so, employees and members of the medical staff are encouraged to be more transparent as they join leaders in finding systemic solutions toward the prevention of harm. Physicians and nurses across the U.S. have been hesitant to report errors in their organizations, fearing retribution from senior leaders. To radically alter this perception, a just culture is required to eliminate the culture of blame and gross underreporting at every level of an organization. A transparent culture recognizes that defects in care are meant to answer the question, what can we learn, not who can we blame. Some of the processes and approaches that have been developed undermine this shift as it violates the safety culture needed to report all errors, including rules that describe what not to do and then prescribe certain punishments, including dismissal. Instead, opening communication from all levels allows dissension and differing opinions a safe place to be heard and the incident discussion to remain animated. Constructing the infrastructure for staff, including quality and safety-based compensation, management, collaboration, and accountability, help promote the safety culture needed in a just culture. Managers are tasked with ensuring team members perceive and believe this to be true for it to be effective. Hospital Board of Directors oversee a variety of issues, including monitoring and evaluating high-level organizational executives, strategizing the organizational mission and goals, making sure the hospital serves the needs of the community it serves, ensuring financial viability, and safeguarding the quality and safety of care provided by the organization. However, historically, hospital boards have had a relatively small footprint in evaluating and improving quality and safety. Having a board that is knowledgeable about quality and safety issues encourages the adoption of high reliability practices throughout the organization. The board can influence quality and safety largely through their ongoing interest and pursuit of accountability for safety. They hold the fiducial responsibility to ensure unprofessional or incompetent clinicians do not put patients at risk as part of the board's responsibility for credentialing of the medical staff, and by making safety performance an explicit part of how leadership is evaluated. To achieve this level of non-punitive discussion, Board members must protect the sanctity of a blame-free environment, which promotes the reporting and open discussion of errors, near misses, injuries, and death without fear of reprisal. These transparent conversations must include everyone involved. A primary obstacle to honest reporting is the negative response received and anticipated by employees. Employees must trust that they will be treated fairly and justly for them to confidentially report safety events. Other barriers include a general lack of concern over understanding root causes of failures, or little to no accountability by leadership and staff to achieve high levels of safety. The core value of zero harm must be shared among board members, senior executives, and team members. The presence of fear, blame, or apathy are harmful barriers to quality improvement. In most organizations, leadership promotes a just culture, but employees' perception and fears speak otherwise. The 2016 User Comparative Database Report from the Agency of Healthcare Research and Quality compiled data from 680 U.S. hospitals. This report suggested that one of the top 3 areas for potential improvement is non-punitive response to error. The survey results from just short of 450,000 staff respondents indicated that 49% of staff believe their mistakes are held against them. 52% believe that they are being reported instead of the problem. And 63% believe their mistakes are kept in their personal file. This poses a significant obstacle to error reporting. To pursue high reliability principles, leaders must build trust and exhibit transparency to create the safety of reporting encouraged in a just culture. Every effort to objectively analyze each event and to identify subtle inherent risks must include those individuals who made the error, such as physicians, clinicians, or other team members. Only when the individual involved is participating in the process can subtle risks be identified and meaningful improvements developed. A just culture encourages reporting and learning in a trusting environment, which eventually prevents accidents. Change in culture alone will not improve safety, but a just culture will improve organizational learning capabilities, which in turn lead to more effective safety practices. To learn more, contact Relia Healthcare today.